Is a very abbreviated form of the frozen shoulder video where I will tell you, like I did in the office, it is Civil War surgery. There's nothing elegant about this recovery or the surgery itself. You must do these exercises. And people will always ask me, how many times do I do them? You do them 1,000,000 times, meaning as many times as you can, particularly in the first week. If you can keep the range of motion in the first week, you can keep it. It's yours. If you do not keep it in the first week, you will lose it. It will go back to being frozen. And so please don't do that because you don't want to do surgery again. So there are only 3 exercises that matter, okay, in my experience. And you're going to need help in the first couple of days with some significant other person in your life who's willing to dedicate 2 or 3 days to you. Okay, put movies in, whatever you want to do. But basically, the first exercise is what I call the teacher exercise. Well, you say, hey, teacher, I got a question. Well, that's what it is. And basically, the key thing is to get as much as you can. You know that I show you the day of your surgery. I show you that I can do this for you in the post-op care unit. Okay, so you know it darn well moves that way. So you make sure it stays that way. Teacher is the one. The second exercise I want you to do is stop. So just think about somebody going stop. Okay, and the key thing is to you got to get this angle here with the elbow going down. If the person's up like this, they will stay stiff. You've got to be able to drop this almost flat to the table, and this hand rotate out like this. Very important. And it's very important to do that, particularly in that first 48 hours when the nerve block is working. Because if your brain doesn't get that in the first 48 hours, you will not have success after the block wears off trying that. And then the last one, Liv, I'm going to have you come up. I'm going to have you just stand right here and face that way.
Face this way.
Okay. And the last one is handcuffs. Okay. So basically, you're gonna take you have somebody take your arm and basically rotate it above you. Okay, so like you're gonna be in a handcuff position. Very important to be able to do this. Okay, and those 3 exercises, if you can do that for a week, you can keep it and it'll be yours. You'll have a successful outcome. So just make sure it happens. You can do this. You got this.